Welcome to the Rational Egoist. I'm your host, Michael Leibowitz, and with us today we have Linda Elder. She is the author of Critical Thinking Therapy for Happiness and Self-Actualization. Linda, thank you very much for being here today.
Thank you for having me.
So, I originally reached out to you because I looked up experts on critical thinking and you came up. And at the time, I knew nothing about this critical thinking therapy, but I ended up reading your book and it's very enjoyable. So I want to focus most of the discussion today on critical therapy. But first, I want to know, how would you define critical thinking and why is it important?
This is a good starting place because we need to understand critical thinking itself before we can ask, how does critical thinking help us with therapy? Critical thinking is both simple and complicated. We will just begin to get into what this is in a few minutes, but let me give this a try. So everyone reasons. We are continually reasoning, we're continually coming to conclusions, or we are routinely are as we go through our day. The question is, how good are the conclusions we're coming to? How reasonable, how rational are they? Are they defensible conclusions? So critical thinking helps us stop the reasoning process, examine the reasoning process, see if there are any problems in the reasoning that we're doing, and then change our thinking as needed, and then move on to a higher level of quality. So what critical thinking does is it provides us explicit tools for entering our reasoning and for correcting reasoning. So there are some conceptual sets that I'll just very briefly mention at the core of a defensible conception of critical thinking. First of all, we need to know what is involved in reasoning. What does that even mean? Well, we can boil reasoning down to 8 parts. Whenever we reason, we have a purpose. We're asking questions. We're using information. We're making inferences or coming to conclusions. These conclusions are based on our assumptions, connected with our concepts, coming from and informing our point of view, all of which leads to implications and consequences. So I named 8 elements. These are always involved in our reasoning. Right now, you and I are using these elements. You have a purpose. I have a purpose. Our purpose may change as we move through this talk. We're asking questions. We're using information. We cannot avoid our reasoning. It's there. So we ask then in critical thinking, well, how do we make sure that our purpose is of high quality, that our questions are of high quality, that our conclusions are of high quality? How do we know this? Well, that's where the word critical comes in. And critical we can equate very simply to the term criteria. So therefore, criteria for thinking, criteria for reasoning, critical thinking. So what do we mean by criteria? What is the criteria that determines whether some thinking is of high or low quality? Well, criteria has to be applied in context. But let me give you some simple criteria for reasoning that all people who reason at a higher level are always adhering to the extent that they can. These people who are thinking in this way are clear, they are accurate, they are relevant, they are broad when more than one point of view is relevant, meaning they consider all relevant points of view. They're able to reason with depth, or in other words, through the complexities in the problem. Their thinking is logical. Their thinking is reasonable. It is sufficient in context, and it is fair. These are some of the essential intellectual standards that good reasoners have always adhered to. What we are trying to do is bring these tools explicitly to everyone who wants to develop their reasoning. And then we are not just focused on skills, that is the ability to clarify our purpose or make sure our information is accurate. All that is required. But what we're ultimately reaching for is a way of living so that we're developing characteristics of mind. We're moving up as self-actualizing persons through the development of intellectual and ethical virtues, such as intellectual autonomy, intellectual humility, intellectual integrity, intellectual courage, intellectual perseverance, confidence in reason, and fair-mindedness. So notice I've just very briefly introduced 3 conceptual sets that we need in a reasonable conception of critical thinking. Now, finally, to conclude the core of this reasonable conception, we need to understand that there are problems in our thinking that come from 2 primary orientations of every human mind, and that is egocentric thinking and sociocentric thinking. So all of us sometimes are locked within our point of view, our egocentric, therefore narrow, therefore somehow illogical point of view, the egocentric side, or we're just being selfish. Or we may be locked into the sociocentric side, looking to be validated for our beliefs and our ideas, getting our sense of self from other people, going along with the crowd, even though we have not critically analyzed what it is we are going along with. So these are just entry places for thinking about what a rich conception of critical thinking can do for us. And this is at the heart of critical thinking therapy.
So critical thinking therapy, how does it differ from other popular forms of therapy, say psychoanalysis or cognitive behavioral therapy?
So let's go back to about the 1950s. In the 1950s, what we begin to see is some theoreticians moving away from a strictly Freudian or analytic viewpoint and saying, it's this going back and digging up your memories from your childhood, it doesn't seem to be working. We've got to go beyond that. We've got to figure out what else we can do. And Albert Ellis was one of those early pioneers who realized the relationship between thinking and the affective side or the emotional side, the motivational side. And what he said is, look, we need tools for intervention right now at the moment when the thinking is going wrong. And he therefore spent a number of years developing his theory, providing very well-written books for people who had problems with self-esteem, who were what he called self-defeating. And we really begin in that era to get a birth of what will then become cognitive behavioral therapies moving forward and up to today. And though many cognitive behavioral therapies may be good in themselves, some of them are misleading, and they're not actually focused on the thinking underlying the feelings. They're not using active strategies for intervention. So what critical thinking therapy does is it does connect with cognitive behavioral therapies in the most basic point, which is, again, that if you want to command the mind, you're going to have to command the thinking that is driving everything in the mind, or in other words, the affective dimension. So that there is this interconnection between critical thinking therapy and cognitive behavioral therapies that are well done. But what critical thinking therapy does is it goes way far beyond the current toolbox being used in therapies, cognitive behavioral therapies, so that we have much more to offer the client through the tools, the robust tools of critical thinking. So a lot of critical thinking is being done in multiple therapies. But what I argue in the book is, first of all, we need the tools of critical thinking to apply to our own thinking and to improve our own thinking, to expand cognitive behavioral therapeutic approaches. But we also need the tools of critical thinking to critique any other theory. So, for example, you mentioned psychotherapeutic approaches. Now, there isn't anything wrong, of course, with going back into your childhood and finding things that may be causing you to suffer today. There isn't anything wrong with that, at least on the face of it. And we do want to know what is driving us. But most of us, I think, know people who have done that, and they're continuing to do that. They continue to wallow in their past. And critical thinking therapy and rational emotive behavior therapy says that's not needed, because what we can do is, as it were, push all that aside, close that door to the mind, as it were, in essence, forget all of that and start over with today with actual intervention strategies. Now, you may say, hey, that sounds overly simple. And in some cases, it may be. But the fact is that we have to ask ourselves, what strategies am I using? And are they enabling me to live at a higher level of self-actualization? And whatever therapies we choose must do that maximally. And again, there is a place for multiple therapies to be used depending on the client and the individual. And one of the things that I argue for in the book is that, look, every one of us has the ongoing task, if you will, of keeping ourselves mentally well in a world that is very often pathological. All of us face this same challenge in one sense, but we don't face the same challenge in the sense that some people had much more difficult pasts that they had to overcome, experiences in childhood that, for example, were very difficult and were very harsh. And yet we see across the spectrum that people rise above their situation very often, whether they were born privileged or not. So we have our own individual orientations that we come to the world with. You could say our genetic predispositions. And then we have the learning component, and the world is continually influencing us and hacking at us and trying to get us to change and warp ourselves. And somehow we end up as adults having made it through the indoctrination systems that we've been thrust into. And again, we have to ask, what do I personally need to make sure that I am mentally well? And that may be art classes. That may be more exercising. That may be more deep reading. It will depend not entirely on your individual nature, because all of us need some of these things. All of us need exercise. All of us need to eat in ways that are not offensive to our bodies. All of us need to do certain things to take care of ourselves physically. But we have to realize that we have the individual orientation, and then we have group influences. And in the end, I have to decide for myself how to make sure at the end of the day that I'm doing some smiling and I'm doing some laughing and I'm enjoying that cup of tea if I can.
You know, learning that my thinking was largely responsible for my dysfunctional feelings, for my dysfunctional actions, was extremely empowering, because not only did I learn the role that my thinking played in causing me problems, but I also learned that I could change my thinking and how to go about changing it. And Albert Ellis played no small part in that. I read his books, New Guide for Rational Living, Growth Through Reason, Reason, Emotion, and Reason and Emotion in Psychotherapy, all very, very helpful. And I noticed in your book, you speak very highly of Albert Ellis's approach, juxtaposed with later variations of cognitive behavioral therapy, which came out of his, were largely influenced by his rational emotive behavior therapy. And I'm just curious, in what ways has Albert Ellis influenced you, and in what ways do you differ? And I'm also going to throw in, you use self-actualization, so I'm interested to know if Abraham Maslow has had any influence on you.
Mm-hmm. Those are good questions. I would say that yes, I have been influenced by Albert Ellis, most certainly. And I appreciate especially the depth of his thinking. And if you study his approach from the point of view of critical thinking, of the tools that I've been mentioning, what you're going to find is that Albert Ellis in his works typically uses again and again and again some primary critical thinking concepts and principles. One of them being this: follow out the logical implications of what you are saying or what you are doing. So in other words, is this logical? And think of the implications. So for example, you have, he has an example of a woman, let's say she's afraid of dropping her tray in a cafeteria. And so he's saying, now let's keep going here. So what would happen? Let's imagine that you dropped your tray in front of all of these people. What is the worst thing that could happen? And, you know, the worst thing that could happen is they all start laughing as hard as they could at you. And of course, we know that that's not likely. So he's going to point out that it's not likely, but still, let's say that that did happen. Let's say everyone in the room just starts laughing as hard as they can at you. How does that go? How does that really harm you? Is that really going to affect you? Why should that affect you? You see, is that really something that is a danger to you? So he keeps bringing you back to the implications. Think again. Well, let's imagine that you didn't find that perfect lover, that you never found that person, and you always wanted to find that perfect lover. Well, what if you didn't? What would you be able to still go on? And would life still be worth living? Follow out the implications here. So again, Albert Ellis takes a few critical thinking terms, concepts, and principles, and he works them very well. Now, so he has a lot of very powerful ideas, and I would say everything that I've read of his work is sound. And now, what does critical thinking therapy do beyond that? What critical thinking therapy does is it provides a critical thinking framework for application across all the domains of your life. And we're not just focused on, for example, implications or consequences or logic. We're saying you need all of these tools. You need to know, what is my purpose right now? What questions am I asking? What am I inferring? What assumptions am I making? What is my point of view? Now, you may look in Albert Ellis's book and see a lot of these concepts, but what we're doing is we're bringing them together for the therapist in an integrated way, which has never been done before, which includes also this very powerful set of concepts, as I said, which are egocentric and sociocentric thinking, which are umbrella terms for much larger sets of phenomena. So, for example, take fallacy theory. Well, that all fits under egocentric or maybe to some degree sociocentric thinking. Look at for example, politicians today. One of the fallacies that's being used quite effectively is the fallacy of cherry picking. I mean, out and out lying is also one approach that's being used, which is under the area of egocentric or sociocentric thinking. But cherry picking is powerful because you can pick actual facts and just blow them out of proportion and take them out of context and present them to people who themselves lack critical thinking abilities. And then you are, as it were, home free, because you're able to convince people of things that are not true, and that these things that you're convincing them of are not in their interest, but in your narrow sociocentric interest. In this case, I'm talking about, for example, certain politicians. So what we need is this robust conception, because our thinking can go wrong in so many directions, and critical thinking the tools for critical thinking therapy are the same tools that we need for thinking economically, for thinking about civics, for thinking about intimate relationships, for thinking about every part of our life. So that's a little bit on the relationship between rational emotive behavioral therapy and critical thinking therapy. I would say rational emotive behavioral therapy should be a subset of critical thinking therapy because it would be included in, and critical thinking goes beyond because the tools go beyond the tools that Albert Ellis was using at that time. Now, Maslow, let me just comment on Maslow. One of the ways in which I've been affected by Maslow's thinking is primarily in thinking about how he articulated the skills, abilities, and orientations of the self-actualized person. Now we can change that to self-actualizing, which is probably the better term, because to be self-actualized seems to imply that you've arrived, you're there. We never arrive as humans. We're never perfect, so we're never finished with development. But we want to be self-actualizing, meaning that we want to maximally control the moves of our minds. So if a person is starting to feel depressed or starting to feel anxious, what is the intervention strategy? What is the move that you're going to make right now? And there are many possibilities, but you're going to have to make one. And it's like when people say when they're trying to give up smoking, they know that they're going to have intervention strategies. So you're going to pick up that cigarette, you're about to take it out. What are you going to do? You're going to walk outside, you're going to just start moving. You're going to have some strategies. But what we need as well as strategies are exemplars of thinkers who are engaging in the kind of thinking that we all would need to engage in to be mentally well, not forgetting the pathological world that we are often ensconced within. So what Maslow did then is he looked at a few individuals. He has been critiqued for his qualitative style studies, but as a critical thinking theoretician, I can readily see in his short list of skills, abilities, and traits of the self-actualized person direct parallels with critical thinkers at the highest levels.
Something you talk about that resonated strongly with me is the idea that a person has to be willing to face what's going on inside, face the truths. Mm-hmm. On my path, and as I've grown and changed throughout many, many years, I've had to face some very uncomfortable truths. And when I talk to people about it, what I tell them always is, well, the problem is if you don't face it, it doesn't just go away. It's going to be a problem whether you want to acknowledge it or not, but the only way to fix it is to acknowledge it. And it's similar to me about someone who doesn't want to go to the doctor, right? They're afraid if they go to the doctor, they've got maybe a pain in their side and they don't want to go because it could be something wrong with their kidneys and they don't want to know about it. Well, not going to the doctor is not going to heal the kidney. So if there is something wrong with the kidney, you want to go and you want to find out. Mm-hmm. And I would just like for you to just touch on that a little bit, on the importance of being honest with oneself and of facing whatever there is that is tripping you up in life.
It's a very good point, and it's a very good analogy. And it's a very good analogy because there are many cases where people after the fact said, I don't know why I didn't go. Because if I'd gone, I would be all right now. If I'd gone to the doctor, but I didn't go, so now I'm not all right. And but the difference, and that is a concrete example, but the mind is even more elusive when it thinks that there aren't concrete examples. And the one thing to realize is that when you are on the critical thinking path, when that is your goal, when that is what you are motivated toward, then you realize that facing the problems in your thinking is just a normal part of your everyday routine or life. That if you're not looking for problems in your thinking, then you are probably making a lot of mistakes in thinking. And you're probably also highly self-deceived. Now, let me mention something about this problem of self-deception and the fact that egocentric and sociocentric thinking, which are always somehow dysfunctional, they're functioning at the unconscious level, at least to some degree. And as long as the thinking can stay at the unconscious level, then it can basically have you doing something like chasing your tail while you're thinking you're doing something that is reasonable. But what you're really doing is you're hiding from yourself. And there is a concept that I think is very helpful coming from psychology, the concept of cognitive dissonance. So if you imagine that at that moment when you are choosing to deceive yourself or not, there's a second or a half second or some 30 seconds, some short period of time when the rational self, or you could say the rational mind, is arguing with the irrational mind, where it's saying, no, I need to do the right thing right now. And I really know, why should I do that? And then the ego tries to take over, and then it takes over, and it gives you all these reasons why you don't really need to consider the other person's point of view, for example. And so it gives you all these reasons, but those are not the real reason. The real reason is because you want it your way. That's the real reason. But the ego doesn't operate like that. It just uses any reasons that it can and to justify in its own mind what it's doing. In the meantime, the rational self that could be developing within your capacities, that could be creating something that is worthy of your time and energy, that's being diminished because the egocentric side or the sociocentric side are controlling you. And as long as that's happening, you will never reach your potential. You can never reach into your capacity at a high level as long as you're deceived as to what is really going on with your mind and in your life. And for example, many people are self-deceived about their, let's say, romantic relationships. They are settling for what they've got. Neither one of them is necessarily happy in this example, but they're unwilling to face the truth about the relationship. But you see, the truth is there. It's just right underneath the surface. It's not as if you can't figure out what the truth is. You see, it's not as if we aren't smart enough to figure it out. It's that we're not motivated to figure it out.
So when people are in the process of evading truths, whether, about themselves, about the people they care about, their job, whatever, you talked about the defense mechanisms. And I'm just wondering, maybe it's just the defense mechanisms, maybe you have some other answers, but what would be some signs to look for that a person is engaging in self-deception?
Well, I think that move that I just made, cognitive dissonance, is helpful. So right now, something's happening. There's an argument within myself. It sounds like it's my rational self against my irrational self to make a first early move. And therefore, because let's say an individual given person, I'm committed to living a rational life. I've said that I am. I think that I am. I want to be doing that. Therefore, right now, I'm going to have to require that of myself. So I'm trying to deceive myself. Okay, Linda, you need to stop. You need to get out a sheet of paper. You need to write down what it is you are trying to keep yourself from seeing right now. Because egocentric thinking and sociocentric thinking, they can't stand the light of day. So if I write down everything, life should be without problems, and I never should have to deal with, let's say, bureaucracy. And so I'm about to call one of these bureaucratic groups, and I know that I'm going to be on hold for some length of time. You can imagine yourself you're starting to get already tense, and my ego's about to come out as soon as somebody answers the phone. Hello, can I help you? Now look, so you're already about to jump down their throat before they even have a chance to help you. No, it's all right, ma'am. I'll help you. So you see, you have to be, first of all, committed to not being that way. And second of all, you have to be aware of these times when your mind is trying to play a trick on yourself. And of course, in the critical thinking therapy book, we have a lot of activities for people to work through to help them. So there isn't a simple strategy. It's really that we need a reasonable philosophy by which to live. We need the toolbox of critical thinking, not just a few of them. We need the whole toolbox, because there's so many ways in which our thinking can go wrong. So I could say, for example, here's an easy activity that I see that people use early on in developing critical thinking abilities. And that is, whenever you have a negative emotion of any type, stop and say, what is the thinking leading to that feeling? That's all. And notice that that doesn't get into any kind of complex theory of critical thinking, but it's an entry place, and it's a quick strategy that I can use on a daily basis. So I'm feeling like things are all right, and I'm doing this and I'm doing that, and now I'm reading this, and suddenly I'm feeling I'm not happy right now. I'm feeling a little bit of, let's say, the blues. So then I say, stop, Linda, because a few minutes ago you weren't feeling that. So why are you feeling that now? Oh, it was because I read this, and now I need to go back and address that. If it's something that I can do something about, then do something about it. If it's something I can't do anything about right then, but I can do something about later, then leave it until then and let it go. But no, you have to deal with it later. But if it's something I can't do anything about, then I'm going to have to let that go. And often it is something we can't do anything about that we're focused on, that is causing us problems. So first we say, I've got a circle of influence. It's not very large. In fact, it's really small. And I've got to stay within that. So if I get outside of what I think I can control, then I'm going to be unhappy, because I'm going to be trying to control what I can't control. I can't influence these people, can't influence those people. These people won't listen. Those won't listen. So get back into your circle, Linda, and focus on the things that you can control. So these are some fundamental moves you see that we can make. But some way maybe joining us right now who isn't a person who's particularly easily depressed or anxious, or doesn't have any of the problems that we've talked about so far. But maybe they have this problem, that they're highly intellectually arrogant, or they are easily angry at when they shouldn't be at other people, or any other number of problems that get in the way of our self-development. Critical thinking provides a toolbox for any problems in reasoning.
So you are no fan of the medical model of treating psychological problems. You even mentioned in your book one of my heroes, Dr. Thomas Saz.
Mm-hmm.
So what is, or why is critical thinking therapy superior to medical treatments, whether they be psychotropic drugs or electroconvulsive therapy or that transmagnetic thing they're doing? Why is it better to take an approach like the therapy that you engage in?
Well, number one, whatever other procedures you allow to be done to your body, no matter whether whether you are taking some kind of psychotropic medication, or whether you're doing art therapy or anything else, you're going to have to reason to that decision. You can't avoid that. A doctor can say, take this, but you have to make the inference that I'm going to take this. So number one, even if you were to take all kinds of medicines or not, or this kind of therapy or not, your reasoning is what is going to determine those decisions. So you cannot avoid your reasoning, even if you partake in any other thing. So that's the first thing. Therefore, logically, we need to know what we are actually deciding to do when we make the decision to take something like psychotropic drugs. And we need to make sure that, well, like, let me back up and say, you would think, most people would think that they could depend upon the medical and the therapeutic community to take care of them as clients in this process, to make sure that their interests are taken care of. We should be able to assume that, but we cannot assume that, because at some point, especially in schools of psychiatry, because psychiatry is a medicine, is coming from medicine as against psychology or social work, where the therapists are not coming, they weren't first trained as medical doctors. But those people that are trained as medical doctors and then become psychiatrists, well, before psychotropic drugs came onto the scene, they were primarily using a psychoanalytic approach, a very hardcore and often problematic psychoanalytic approach. And when it looked like they could easily turn to pills to solve the problem, then that became the thing that they mainly do. And that is holding to today. Now, if I'm going to take any psychotropic drug, I'm going to need to have proof that this is safe. From my reasoning tells me this. I'm going to have evidence that this is safe. But I know that for many, if not most of these medications, that evidence is not there. That most of these psychotropic drugs have not been studied long term. They were only ever designed for short-term use, and only in very unusual cases, not to be handed out like candy, which is what's been done. And what we find is for people who have psychotic episodes, which, look, a psychotic episode should not be surprising if we think about the way we set up human societies. Because you have a person who's disconnected, who says, I can't handle any of this. I've just lost it. And there's a disconnect. But typically these people under the right conditions will work their way out of that. But, and I'm not saying in every case, I'm not commenting on every case, but in general terms, what people need to know is that psychotic episode then may be treated in a long-term way with medications that actually over the long term actually do cause them to become permanently psychotic. Now, if I am in such a position, I think I as a client have a right to all of this information. And in the book, all I'm trying to do is begin to help people ask some of these questions and to see that for decades, we have known the problems that I'm talking about with psychotropic drugs. And we've known that psychiatrists are often in bed with pharmaceutical companies. And as long as you have that, you're going to have the problem potentially of vested interest. So as a person who's being told, hey, Linda, you need to take these drugs, I think I have a right to know all of that. And then I can decide, using my own reasoning, whether to participate in that. And there are lots of different classes of these, and they all have to be treated somewhat differently. And there's a lot of science that we would have to look at to really do a deep dive into this. Several critics in the field have done that. I'm quoting mainly in the book from those people who have spent a lifetime uncovering this problem. But it's a very serious problem, and it's going to affect someone's ability to function using their reasoning if the medications are continually interfering with their reasoning. So first, we are reasoners. 2, we need to command that reasoning. And if a medication is taking me away from that command, then I need to be asking questions.
I think it's important to note too, and I don't know how many people are aware of this, but there's really no objective test for these mental illnesses that they're diagnosing. And what I mean is, it's not like you go and give a blood test and they say, okay, we've noticed that you have a chemical imbalance that likely is going to be causing bipolar disorder, right? They're going by what the patient tells them, and then they're diagnosing that within the framework in which they're operating, which often leads to different diagnoses. I remember when I was a kid, and I must have had, I don't know, 5, 6 different diagnoses, depending on where I went. I mean, I was diagnosed with PTSD, with depression, with anxiety, and then older, it was generalized anxiety disorder. When I was a kid, I was socially, emotionally maladjusted, but I don't even think they have that anymore. So it's important to note that this is not anywhere near an exact science. And so I take an SSRI myself, selected serotonin reuptake inhibitor. So I'm not saying that nobody should ever take medication, and I don't think you are either, but it's important to be careful and be involved in your own diagnosis and in your own treatment, right? Would that be an accurate way to put it?
Absolutely. And I know that there are a lot of people taking medications for things like depression, which may not be problematic. I was mentioning before the psychotic drugs, which are in a different class. So again, it's a matter of your own personal body and your own personal life. And we need to make sure that we are making those decisions. But now you bring up another big piece of this. You say, you brought in a few terms, and I'm just going to connect to these. Okay. You said there's not an objective test. You said it's not an exact science. So now let me say this. Not only is it not an exact science, it's not a science. You see, what we need to do is realize that the mind is not the brain. It's tricky, but the mind is not something is not concrete. It's not something you can hold in your hands. You can't, obviously it's coming from mainly or strictly, or however we conceive of this, the brain. The brain is causing the mind to be operating, but the mind itself is not scientific. It is conceptual. And reasoning is conceptual. So therefore, that what we need to replace the medical view of the mind with the conceptual view of the mind. And that doesn't mean that there aren't scientific studies or components here, but that fundamentally we're looking at the mind as conceptual. And therefore, in this model, we would be very cautious in giving people, for example, any labels. Now, labels are driven to a large degree by insurance companies. And we can't allow insurance companies to decide any of these decisions because, for obvious reasons, they're not competent to. So, but the labeling is beyond the point of absurd. I mean, the DSM, whatever number we are at, in all of the many ways in which any one of us could be dysfunctional, you have to wonder how such a list could emerge and how many people could could possibly fit into any of these categories. So the very idea of labeling a person is problematic because everyone is an individual. And if we see patterns among people, okay, fine, but we need to be very careful in the way we deal with those patterns or even the way we articulate them. And then I could say, well, take a concept like psychotic. Well, if psychosis is a break from reality so that you're no longer seeing reality as it actually exists, then should we apply that to whole groups of people who support politicians who seem to be disconnected from reality? Are those people psychotic? Do you see? Then the experts say, no, you can't use it that way because there are too many people that you would have to put in that category. But you see, if you think conceptually and not within the scientific approach, then you have much more scope for understanding what we're talking about. And you begin to see, well, then maybe the very concept of psychotic is problematic, or maybe not. But in any case, you see problems in it. And so, and you yourself know that you mentioned that you were labeled in various ways, and you know that affected you to some degree. You may have had to work your way out of it. Maybe you rejected it. Maybe it took you a while to reject it. But mainly people, I think, do accept the categories, the labels that they're given. And we do this very early in schools, and all kinds, and not just in terms of medical terms, but in all kinds of other ways we label people.
You know, it didn't happen to me, but I certainly have seen it happen to people who are diagnosed, especially when it came to addiction, when they would conceptualize addiction as a disease, is it breeds a sense of helplessness in people. Mm-hmm. That they have this disease. And then what seems to happen is it takes away the agency of the person, or personal responsibility, where it's no longer, this is my mind and my life, I have to change the way I think and act, to, you don't understand, I have a disease and therefore I can't behave properly. And I've just seen that happen so many times. I wish that they would do studies, that someone would do studies on the effects of psychiatric diagnoses impact on the sense of personal responsibility that people have, on self-efficacy or locus of control, things of that nature.
Mm-hmm. Well, and now the concept of attention deficit, I'm going to say disorder, but I'm going to take it right back, because I don't think it's a disorder. And I think studies are now showing, lo and behold, that there are a lot of advantages to a mind that is thinking in this more, as it were, hyperactive way. You may see things that other people don't see. And we're seeing, even take the studies on autism, which show a lot more people being diagnosed with autism and on the so-called spectrum. And it could be that what we're starting to appreciate or see but not recognize is that I go back to this, everyone is a unique individual, and everyone has, I think every individual has capacity to develop into their best self. And that means their most creative self and the highest level of self-actualizing self. But through things like labeling, we feel that we're supposed to be like someone else instead of just being who I am individually. And so I think that some of these labels, like attention deficit, that comes about probably mainly because schools don't serve students very well. If you're not engaging the intellect of students, and the students are bouncing around the room, well, what would you expect them to do? You're not engaging their intellects. You're violating their very nature in a way by not engaging that. So they're climbing under the tables and they're bored, they're causing problems. And that's not the only reason why this occurs, but it is a big reason. And we know this because smaller and smaller and smaller children are being medicalized. What is that about? I mean, a third grader, a 3-year-old, a 4-year-old, a 5-year-old, 6, 7, 8. These kids are supposed to be acting like that. They're supposed to be acting wild and crazy. That's called childhood. So we've got to look at all of these social ideologies that lean upon us, and we've got to reject those that keep holding us down. And the idea of myself as a potent individual, as a person who can command my emotions, can command my thinking, this is what I would want for everyone. And this is at the heart of critical thinking therapy.
Well, that's a great way, I think, to conclude the conversation. That was excellent. So, Dr. Elder, where can people find you?
They can find us at criticalthinking.org. Our organization, the Foundation and the Center for Critical Thinking, are the longest run organizations on critical thinking in the world. We started in 1980 at Sonoma State University in Northern California. We are now independent and we are international, but you can reach us there. You can purchase the book through that website, criticalthinking.org. We have a color version and a black and white version. We also have a community, critical thinking community online, and you can go to the same website to find us. Or critical.
Mine's a different color than yours. Mine is red.
You have the black and white version.
Oh, okay.
I have the color version.
Okay.
I'll show you because you don't have this. I didn't send you the color version, but lots of people prefer this because it does have.
Oh, okay. I see.
And a lot of our work includes diagrams. So we need for this to be visually beautiful.
Okay.
And that is why most people are choosing the color version. And
Okay.
people can also join us in our community. We have free webinars for everyone. We also have long-term study groups for people to join with us, to meet every other week and read in the classics and read in critical thinking. Many people do that for their sense of well-being emotionally and mentally. It's not a therapeutic group, but obviously we're dealing with all of the tools of critical thinking, and we are concerned to be self-actualized. So I invite everyone to join us there. All of us need, I think, people to help us on this path. And not the more people we have, but when we have that, we have a much easier path to our own development. So I hope that all of you will join us.
Thank you so much. And thank you for taking the time to be with us today.
Thank you for focusing on critical thinking therapy.
For now, this is the Rational Egoist signing out. I'm Michael Leibowitz. Till next time.